I am Dr. Laura Moreno, and in this video, I want to talk to you about something millions of people take every single day without thinking twice. Something that is considered normal, safe, and routine, yet over time can cause real harm when it's used the way most people use it. I'm talking about common over-the-counter painkillers and anti-inflammatory medications, the kind people take for headaches, back pain, joint pain, menstrual pain, muscle aches, or just to get through the day. These medications are everywhere. They're in homes, offices, purses, cars. People take them before work, after work, before bed, sometimes even without remembering when the last dose was. And because they don't require a prescription, they're treated as harmless. But harmless and familiar are not the same thing. To be very clear from the beginning, these medications are not evil, and they do have an important role in medicine. The problem is how they are used, how often, and how casually. The real harm doesn't usually come from one pill. It comes from repetition, habit, and lack of awareness. Many people don't even see themselves as regular users. They'll say, "I only take it when I need it." But when I need it becomes several times a week, every week for months or years, the body experiences that very differently. One of the biggest misconceptions is believing that if a medication relieves pain, it must be fixing the problem. In reality, most common painkillers do not treat the cause of pain. They mute the signal. The underlying issue often continues, unnoticed. Pain is a message. It's the body's way of saying something is overloaded, inflamed, stressed, injured, or not recovering properly. When that message is silenced repeatedly, the body doesn't stop having the problem. It just stops being heard. This is how people end up taking these medications for years without realizing how dependent their daily functioning has become on them. One of the first systems affected by frequent use is the digestive system, especially the stomach lining. Many of these medications reduce the body's natural protective mechanisms in the stomach. Over time, this can lead to irritation, gastritis, ulcers, or bleeding, even if there's no pain at first. A lot of damage happens silently. People often don't feel anything until the irritation is advanced, and by then, they're surprised because it was just a painkiller. Another major system affected is the kidneys. The kidneys rely on stable blood flow and hydration to filter waste properly. Many painkillers reduce blood flow to the kidneys, especially when combined with dehydration, stress, or frequent use. People who don't drink enough water, who consume a lot of coffee or energy drinks, or who take these medications while exercising or working physically hard are at much higher risk. The kidneys may compensate for a long time, but compensation is not protection. High blood pressure is another issue that often goes unnoticed. Some painkillers can increase blood pressure or interfere with blood pressure medications. This effect is usually gradual, so people don't connect the dots. There's also an effect on fluid balance. These medications can cause the body to retain sodium and water, leading to swelling, increased blood pressure, and extra strain on the heart in susceptible individuals. People with diabetes are particularly vulnerable. Diabetes already affects blood vessels and kidneys. Adding frequent painkiller use increases the risk of kidney damage significantly, even if blood sugar seems under control. Age also matters. As the body gets older, its margin for error becomes smaller. What felt harmless at 30 can become harmful at 45 or 60, even with the same dose. Another common mistake is taking these medications on an empty stomach. Many people do this in the morning or late at night. The stomach lining is more vulnerable in these moments, and repeated exposure increases damage over time. Mixing different brands without realizing they contain the same active ingredient is another frequent problem. People think they're alternating products, but they're actually stacking doses. And then there's alcohol. Even moderate alcohol intake significantly increases the risk of stomach bleeding when combined with these medications. This interaction is far more common than people think. What's especially concerning is how easily these medications become part of emotional coping. People take them not only for pain, but for tension, stress, fatigue, or to keep going when the body is clearly asking for rest. Instead of slowing down, the pain is silenced so the routine can continue. Over time, the body adapts. Pain thresholds change. More frequent doses are needed for the same effect. Not because the pain is worse, but because the nervous system has adjusted. This is a dangerous pattern. Headaches are a classic example. Frequent painkiller use can actually cause rebound headaches, creating a cycle where the medication becomes part of the problem it's meant to solve. The same happens with muscle and joint pain. Without addressing posture, movement, stress, or recovery, the pain returns, and the pill becomes the default response. None of this happens overnight. That's why it's underestimated. The real harm of daily or near-daily use isn't dramatic at first. It's quiet. It builds slowly. It hides behind normal lab results and manageable symptoms. And because so many people do it, it feels normal. But common does not mean safe. Understanding this doesn't mean never using these medications. It means using them with intention, not by reflex. It means recognizing when pain is a signal, not an inconvenience. And once you start looking honestly at how often these medications are used, why they're used, and what they may be covering up, it becomes clear that the real issue is not the pill itself, but the habit that forms around it, the normalization of silencing the body instead of listening to it, and the long-term consequences that begin quietly, long before anyone realizes that something meant to help has slowly been causing harm. Now, one of the most important things to understand is who is at higher risk, because the damage does not affect everyone in exactly the same way. And this is where many people underestimate their own situation. People who take these painkillers several times a week are already in a risk zone, even if they don't see themselves as frequent users. The body does not count intentions. It counts exposure. 2 or 3 times a week, week after week, month after month, is not occasional use anymore. Another high-risk group is people who are chronically dehydrated. The kidneys need water to protect themselves. When painkillers are taken in a dehydrated state, kidney stress increases dramatically. Many people drink mostly coffee, sodas, or energy drinks and very little plain water, yet still take these medications. People with high blood pressure, even if it's borderline or controlled, are also more vulnerable. Some of these medications can raise blood pressure, cause fluid retention, and interfere with blood pressure treatments. This often happens silently. People with diabetes are especially at risk. Diabetes already affects blood vessels and kidney function. Adding frequent painkiller use increases the chance of kidney damage, even when blood sugar seems stable. Age matters more than most people think. After 40 or 50, the body's ability to compensate decreases. The stomach lining becomes more sensitive, kidney filtration becomes less forgiving, and the cardiovascular system has less margin for error. The same dose that caused no noticeable issues years ago can start causing damage later in life. Another very common risk pattern is taking painkillers to keep working or pushing through fatigue, not because of an acute injury, but because stopping feels impossible. This is extremely common and extremely harmful. The body is asking for rest or correction, and the response is chemical silence. Now let's talk about how these medications are commonly misused, because misuse is often unintentional. Taking them on an empty stomach is one of the most frequent mistakes. Morning headaches, late-night pain, taking just one pill without food. Over time, this directly damages the stomach lining. Taking them before bed is another issue. At night, stomach protection is reduced, and damage can occur without noticeable symptoms. Taking them several days in a row for the same pain is another warning sign. If pain requires medication day after day, the problem is not the pain itself, but the cause behind it. Combining different products without realizing they contain the same active ingredient is extremely common. Many cold, flu, and all-in-one products include painkillers. People unintentionally exceed safe doses. Mixing painkillers with alcohol is one of the most dangerous combinations. Even small amounts of alcohol significantly increase the risk of gastrointestinal bleeding. Another overlooked issue is that the body can develop tolerance, not because pain is worse, but because the nervous system becomes less responsive. People then increase dose or frequency, thinking the pain is escalating, when in reality the body is adapting. And something very important, these medications do not heal tissue. They do not correct posture. They do not reduce chronic tension. They do not improve circulation. They do not address stress. They simply mute the signal. So the underlying issue continues, often worsening, while the warning system is suppressed. This is how people end up surprised years later with digestive issues, kidney problems, or blood pressure changes, and never connect it to the simple pill they've taken for years. This is not about fear, it's about understanding. Occasional, short-term, well-indicated use is very different from habitual use. The problem is that habitual use has become normal. Pain is not the enemy. Pain is communication. When that communication is constantly silenced instead of interpreted, the body loses its chance to correct itself. And when people finally step back and look at how often they reach for these medications, what they're really trying to push through, and what signals they've been ignoring, a very different question emerges. Not, what can I take for this pain? But, what is my body asking for that I keep overriding? A question that naturally leads into what safer alternatives exist, how pain can be managed without defaulting to medication, and when medication truly makes sense instead of becoming a daily habit that quietly causes harm over time. And that question changes the entire approach, because once you stop seeing pain as something that must be eliminated at all costs, you start seeing it as information. Not always pleasant information, but useful information. So the next step is not never take a painkiller again, but learning when it actually makes sense to use one and when it's simply being used as a shortcut. There are situations where using a painkiller is reasonable and helpful. Acute injuries, post-procedural pain, short-term inflammation, high fever, or clearly defined medical indications. In those cases, the medication is supporting recovery, not replacing it. The problem appears when painkillers are used to manage daily discomfort, recurring headaches, chronic back pain, muscle tension, or fatigue-related aches, without addressing why those symptoms keep coming back. For example, headaches are one of the most common reasons people take painkillers, but many recurring headaches are related to dehydration, neck tension, poor posture, eye strain, lack of sleep, or stress. In these cases, the pill removes the symptom temporarily, but the trigger remains. Over time, the brain can even become more sensitive to pain signals, leading to what's known as medication overuse headaches. The treatment becomes part of the problem. The same applies to muscle and joint pain. Many people take painkillers to keep moving through poor posture, long hours sitting, lack of mobility, or repetitive strain. The medication allows continued overload instead of recovery. Painkillers do not teach the body better movement. They do not correct alignment. They do not restore muscle balance. They simply allow the stress to continue unnoticed. Menstrual pain is another area where frequent use has become normalized. While medication may be appropriate in some cases, long-term monthly use without investigating hormonal balance, inflammation, stress, or nutritional factors often leads to dependence rather than relief. Another overlooked aspect is emotional and mental pain. Tension headaches, jaw pain, neck stiffness, and diffuse body aches are often expressions of chronic stress. Using painkillers for these symptoms doesn't address the nervous system overload underneath. And the body keeps score. What's important here is that the body does not differentiate between painkiller for productivity and painkiller for injury. It only registers chemical exposure and suppressed signals. So what can be done instead, especially for everyday pain? The first step is awareness. Simply noticing how often painkillers are used can be eye-opening. Many people underestimate their frequency until they actually count. The second step is delay, not denying pain, but pausing before reaching for medication. Asking, can I try something else first? Often, hydration, rest, stretching, breathing, heat, or movement reduce pain enough to avoid medication. The third step is pattern recognition. If the same pain keeps appearing, there is a pattern. Headaches at the end of the day, back pain after sitting, neck pain after screen use, joint pain after poor sleep. These patterns point directly to causes. Addressing the cause may take more effort initially, but it reduces pain over time instead of silencing it temporarily. Another important step is respecting recovery. Pain is often a sign of insufficient recovery. Lack of sleep, chronic stress, overtraining, undereating, or emotional overload all reduce the body's ability to repair itself. Painkillers do not replace recovery, they postpone it. This doesn't mean people should suffer. It means they should choose relief strategies that support healing instead of bypassing it. It's also critical to understand that using fewer painkillers often leads to initial discomfort because the body's signals become more noticeable again. This doesn't mean pain is worse. It means it's no longer being suppressed. With time, many people notice that pain becomes less frequent when they stop automatically masking it and start responding to it appropriately. The goal is not perfection, it's consciousness. When painkillers are used intentionally for short periods with clear reasons, the risk is much lower. When they are used reflexively, daily or near daily, the risk increases silently. Millions take these medications daily, not because they truly need them, but because no one ever explained the difference between using a tool and living on it. And once that difference becomes clear, people often realize that the real harm was never just the pill itself, but the habit it created, the signals it silenced, and the opportunity for real correction that was delayed. An understanding that opens the door to learning how to manage pain more intelligently, how to support the body's natural recovery systems, and how to decide without guilt or fear when medication is appropriate and when it's simply masking a deeper issue that deserves attention. Subscribe to the channel and turn on the notification bell so you don't miss future videos where we explain everyday medications and habits with clarity, balance, and medical responsibility. Share this video with someone who relies on painkillers more often than they realize. Leave your questions or experiences in the comments and join me as we continue learning how to listen to the body, manage pain intelligently, and protect long-term health instead of silently paying the price for habits that feel normal but aren't harmless.